Hi, good afternoon. This is Lawrence. I just wanted to share some thoughts with you about where we are as far as the doctors are concerned, as far as healthcare, which in my opinion doesn't really exist, it's sick care. And when we talk about placing scanners for the doctors, I'd just like to put it into a context. So think about this. The doctors are seeing between 20, 25, even 40 patients a day. Imagine seeing 40 patients, 30 patients a day. How much time do you spend with each one? If you work it out, it's like 16 minutes, but you've also got to take out half of that time for electronic records. And the situation for the doctors is actually very, very trying. A lot of them had their independent practices, their own little clinics, independent clinics, solo clinics. Today, many of those have been absorbed by the hospitals. They couldn't afford to keep them. Reimbursements is a problem, insurance is a problem, and as I say, electronic records takes up half their time. So we look at the doctor situation, we say, Doc, what are you doing different today than you were doing 5 years ago? Seeing more patients. What are you going to do the next 5 years different from today? See more patients. So part of what we have to consider is let's look at how the doctors are feeling at the moment, how we can help them help their patients. And one of the ways is to look at preventive medicine. That's a logical sequence to the future. Has to do with preventive medicine. So we're living in a sick care, there is no healthcare, it's sick care industry. The doctors have kind of morphed into being useful messengers for the pharmaceutical industry. So if we can find a way, which we have, of being able to help the physician validate what he or she should know about nutrition, where we know that approximately 70% of non-communicable diseases are preventable. Really? Yeah. Like what? Cardiovascular disease, hypertension, diabetes type 2, lots of cancers, preventable. But we spend 80% of our healthcare budget trying to fix that. So if we can do preventive medicine and we can help the physician validate what he or she should know about nutrition and make money, we have something useful. It's a bingo.